preventable as or not. In the same breath, there are a lot of things that can be done in order to help to prevent falls, make ourselves less apt to fall, and really to give us a better quality of life overall. Um, I welcome questions at the end as you go through the process. Please feel free if for any reason people are having trouble with hearing me, or if I'm speaking too fast, please let me know.
I don't know what she's doing there.
She muted him.
Okay.
As I muted myself. All right, so let's get to here. Let me just share my screen here briefly. Pardon me, I'm not a Zoom expert by any means, but we'll get to that.
I'm going to ask everyone to mute themselves.
Yeah.
Please do that so that we don't get distracted by what you're saying if you're speaking at home.
All right. So staying on your feet, balance and fall prevention. Start with the basics. What is balance? Balance really boils down to four basic things. It's our stability, our equilibrium, steadiness, and symmetry. It's our ability to stabilize ourselves in any position as we go through the course of our day. How do we stabilize ourselves in either single leg stance and single leg balance? How do we create the equilibrium and the evenness in order to maintain ourselves? And on top of that, how do we maintain that steadiness when we're on our feet? Sometimes just being balanced isn't enough. Just being able to stand isn't enough. How do we prevent sway and dips and drops in different aspects of our body positioning? Balance consists of three main systems: our visual system, vestibular system, and proprioception. Vision really comes down to, in a lot of cases, depth perception as being one of the most common things we tend to run into. Our depth perception senses the change of stable items around us. Is the wall moving closer towards you, further away? Is the person you're speaking with moving further away? Becomes dynamic as objects move around us. Driving, walking, if we're walking through, through a trail, is that tree coming close to us? At what point in time is that tree getting close to us? Is there a root on the ground they're trying to, watch for, to avoid down the line? Different problems we run into typically with vision, consist of blurriness, glaucoma, double vision, cataracts. Common problems, again, we come across on a consistent basis that can impact our ability to sense what's around us from a visual field. The vestibular system takes into account basically our sensory system that provides the brain with information about balance, motion, in the location of your head in relation to what's going on around you. It's made up of three semicircular canals. The first canal senses up and down movement. Second canal senses lateral movement side to side. And the third canal senses the tilting of our head from side to side. The sacula and the utricle are also, again, involved in that vestibular system. So within our vestibular system, we have these crystals that basically sit into what we call beta cilia fibers. It's kind of like a pebble on a bed of grass. And when those crystals start to sense our head tilting or us going up or down, they respond accordingly by changing the sense of our vestibular system based off of how we're balanced. Oftentimes, when we run into things like vertigo, as an example, that those crystals get pushed out of direction and create this feeling of unbalance, dizziness, spinning of the room, waviness. So that can absolutely change our balance points and change how we feel about our position in space. Proprioception is probably one of the most underrated things in our body. I refer to this as our true sixth sense. Proprioception is our perception of the position of our body within space. How do I know that when my foot lands flat on the ground, that it landed and struck accordingly? How do I realize I'm transitioning from my heel to my toes and then pushing off? How do I recognize the fact that my foot is actually on the ground versus still up in the air? That I make contact with the ground when I step down off that last step, or if I miss a step and I'm going too far? It's mediated by proprioceptors that are located within the muscles, joints, and tendons. These provide information on limb velocity, how fast the limb is moving, also the load on the limb, and also limb limits. So take, for example, if you push your hamstring too far over top of your head in a stretch, that would be an example of a limb limit. How far can we move before the musculature engages and restricts us from moving from there? Proprioception is probably the most underrated part of our body, though, because this is truly what's going to give you 90% of your input on what's happening around us. What's happening within us versus what's happening around us. Why is balance important? It impacts everything we do. There is nothing that we do on a daily basis that balance is not a key component of. From getting up first thing in the morning out of bed, to sitting in a chair, to driving, to walking, to running, to doing sports and different activities. Balance allows us to do all these different things and do them safely. It gives us the ability to stabilize our body in space and allow us to hold ourselves in position. You know, working over the course of many years in and out of different settings in PT, from internships to my work career, I've seen different patients, whether it be with traumatic brain injuries and strokes, to spinal cord injuries, to just simple orthopedic conditions and post-operative conditions that impact our ability to balance. We don't think about it, but truly balance starts when we sit. It starts at our core and preventing us from tipping over. When we lose things like that, it can be a very dramatic point in our lives that can change a lot of how we function overall. What impacts balance overall? So illness, number one, diseases, surgeries, weakness, lack of movement. The old analogy of if you don't use it, you lose it is very, very true. Also, externally impacting us are the use of assisted devices such as canes, crutches, walkers, and wheelchairs. All of these different things can impact our balance both positively and negatively. If we are weaker, we can't stabilize our body in spaces easily. So naturally, if we get pushed off our position, we don't have the ability to stabilize ourselves and pull ourselves back. If we have a sudden shift of movement, let's say we're walking along the backyard and our foot lands and we hit a little bit of a divot in a pothole within the backyard grass, and our body suddenly shifts over, do we have the strength to pull ourselves back up and stabilize ourselves? Surgery, many of us have gone through that, total knee replacements and hip replacements, lumbar surgery, cervical surgeries, even simple things like GI surgeries can have a massive impact on how we balance and how we function for a variety of reasons. Sometimes pain, sometimes weakness, sometimes fatigue, sometimes also the medications we take. Illnesses very similarly. If we are dehydrated, if we are impacted by prolonged bed rest, that can have a substantial difference in how we function overall after an illness and how our body perceives balance points. An important piece of what we need to talk about here today is center of gravity. It's a point at which our weight is balanced over top of our body. It's subject to change based upon movement. So if we're leaning forward, if we're shifting a certain way, our center of gravity is going to change along with that. What you see demonstrated in the two pictures here is what we refer to as the cone of stability. So this is a vertical cone that comes up from our feet, up through our shoulders and head. And basically it's a distance we can travel beyond our center of gravity. It's different for everybody. But it is impacted by simple things like our posture, like our ability to stand upright, hold our strength and stability in a certain position. Proprioception, vestibular systems, and visions all play an integral role in how we go about utilizing our center of gravity to the best of our abilities. Proprioception, obviously, if I don't realize the fact that my shoulders are hunching forward into more kyphotic position and rounding off, that's putting my weight over top of my toes and changing where my center of gravity is. Conversely, if my vestibular system is off, I can't sense the fact that I'm leaning outside of that center of gravity, nor with a visual deficit like a depth perception issue, I might not realize I'm leaning forward. But that's also where the three systems together need to also correlate in order to make sure that we can create that center and that unity when we start to look at how proprioception impacts, the vestibular system impacts, and how our visual input gives us that feedback visually around us. Posture and its role in balance is very substantial. So we were just referencing before kyphotic positioning, that rounding of the shoulders. Posture is the position of our body, as both a static and a dynamic point. So the three most common positions that we see is kyphosis, rounding and forward head of the shoulders, lordosis, or what we refer to as sway back, which is more increasing that curvature of your back. So when you are kind of arching backwards and you're rounding off your lower lumbar spine, or your neck for that matter, that's more of a lordotic position. The other types of postures would be bending your knees. A lot of us will walk with a more bent knee versus a more extended knee, oftentimes to try and compensate for different weaknesses, strengths, and positional faults that we undergo over the course of time. Number one question I get asked, why did I fall? Well, there's a lot of reasons and there's a lot of things that go into this. So let's kind of start with the most common thing. I tripped. Failed to clear my feet over top of something. That's a definition of a trip. It can be caused by weaknesses. Couldn't lift my foot up high enough physically. Immobility. I was too tight, too restricted. I came out of a boot or a cast, and now all of a sudden my foot is held too tight in one position. I can't clear my foot over the ground. I was tired and fatigued. Couldn't physically create the movement pattern in there. Not being fully awake is one I hear absolutely commonly. I woke up, I was still a little bit groggy. I went to go take my first step. I tripped over my slipper, or my cane fell on the floor and I tripped over that. Very commonly, when PTs come into the house for home care, one of the number one things you will see is they will look around for throw rugs and mats around the areas and try and reduce down as many as they can, because they can absolutely be a tripping hazard. Oftentimes they are mobile. You can catch your feet on them really easily. Also, your assisted devices can catch on them, particularly for patients who are not used to utilizing a cane, a walker, or crutches. Rugs and mats around the home can create a large tripping hazard because you're not used to having to clear this other thing in addition to your feet as you're walking through. Many of us have pets. I got a little 1.5-year-old lab. He's a nut job, but he would easily be around my feet, tripping me up at any point in time. And sometimes, even for me, he'll end up behind my feet. I didn't realize he laid down there. I'm cooking dinner, and all of a sudden I go to move, and there I go trying to trip over top of him. Now imagine that same animal trying to run around us because they miss us. They want to be with us. And now we're trying to walk with a brand new assisted device. It can be very taxing, very tough. So it's one of those things to be aware of, even more so when we have our pets around us, and we're trying to learn to rewalk, learn to gain our balance. We know we're in a compromised position. Other tripping hazards like cords, laundry baskets, clothes on the floor, toys from the grandkids being around, or the dogs for that matter. Those can all be things that can impact our balance and our ability to stay upright. We were referencing this earlier, being sleepy, getting out of bed before you're fully awake. Visual input, your glasses aren't on, your eyes aren't fully opened up. Forget to grab the cane or the walker that you are now new to utilizing. You're not used to having to do that. You're rushing. Again, try to get to the bathroom really quickly. And all of a sudden you're moving faster than your body can handle at that point in time. Slippers are another common thing. Most slippers are not firm fitting around the foot. Oftentimes they kind of pop up and down like a flip-flop. They can become loose and can also become a tripping hazard in their own right. So something to consider if you are in a position where you can use slippers frequently. Might be something where you're trying to find ones that fit more snugly and or are not as loose around the foot. Can create a reduction in potentials for falls based off of that alone. Medications, one of the number one side effects of most medications that we take overall is drowsiness. Medications like sedatives, tranquilizers, even sleeping medications for that matter, can also create that loginess and that snowed effect, as oftentimes I hear from patients. Same thing with muscle relaxers, anticholinergics, opioids, and diuretics. Diuretics in particular can take a lot of that fluid out of our body, certainly for things like swelling in our legs and edema, but in the same breath, it can leave us depleted and dehydrated in certain situations as well. Lack of or improper use, or more importantly, over-reliance on an assisted device. I think I would shock a lot of people when I told them that a lot of patients fall because they're using an assisted device when they don't need one. It gets in their way and they forget that they're dragging it behind them. And all of a sudden they get it caught on something, they trip and fall because they're holding onto the cane. Or they're not using it correctly. We're putting it on the wrong side or we're trying to walk too fast with it. Oftentimes people forget that they need one. You know, they're new to this. It's a new condition or a new surgical approach. Darn near every time people walk in my door, I'm typically correcting cane or walker height. Either it's too high or it's too low. Typically, when an assisted device is too high, you lack the leverage to push down on it. If the device is too low, it's pulling us forward and dropping our shoulders and our center of gravity over top of our toes and creating a layer of instability. Using one when it's not needed. Either people just carry it in one hand, they forgetting to move it forward, or they create more risk than going without one. I always will tell people, consult with your PT or your doctors first if you feel like there's a question mark on whether or not you should use or need an assisted device at this point in time. We can actually help you in order to tell you, hey, listen, you should use it in certain situations versus others. In your home, you're fine now for short distances, but if you're going to the grocery store or if you're visiting a place outdoors where you're not used to the terrain, bring it with you just in case you need it. But we can absolutely help you with that. Cane or crutch on the wrong side should be on the opposite side of the weakness or pain or surgery. A lot of people tend to put a cane or a crutch on the same side as a surgical approach. The reality is when you want to take away one leg that's good and have it help out the bad leg over here, you don't want to put it on the same side over here. You want to replace the leg that's going away. So when we will tell people, if you have, let's say, right side total knee replacement, you want to put that cane on the left side. So that way, as you take away your good left leg, you then can create stability on that left side, but replacing a leg in a sense. One of the easy ways in order to adjust a cane or a crutch height correctly is at the point at which the top of the cane bisects your wrist. When you have your arm straight down at your side, that is roughly the height that you want the cane to be, so that way you can maximize the leverage out of your arm and shoulder to try and help support yourself. Underlying medical conditions, things like hypotension or low blood pressure, heart problems, high blood pressure, heart attacks, history of hypertension, things like that. Urinary tract infections is another big one. Anemia, pneumonia, strokes, even simple influenza, COVID, obviously a big thing in this day and age. Strokes, including mini strokes or TIAs. A lot of people don't fully understand how impactful a mini stroke or a TIA can be. Oftentimes that can create a massive problem for falls that can really go underlying. So weakness is one of the number one reasons why people fall. It can sneak up on a lot of us. We lack the ability to stabilize our body in space. We can't control our body within that cone of stability if we lack the proper strength to pull ourselves back in. When we are weaker, especially in our upper thoracic spine, our shoulders, our neck and head, if that position goes forward, we lose that control of our posture and our positioning. Our legs can give out due to muscular control and or neurological control based issues. Muscular control being an example of weakness of the muscle, or positioning and contraction. Neurological be more things like radiculopathy coming from the lumbar spine, central cord compression and or peripheral neuropathy, or damage to other nerves as they're running down the leg. The death rates associated with falls increase progressively, both year over year, but also as we age. So when we look at fall rates, it is substantially higher, and those death rate totals are a real thing. It's a very real reason why I see a lot of people acting proactively down here in clinic in order to get ahead of these problems before they become bigger issues. Neurological conditions are also a massive reason why we fall. Peripheral neuropathy, like we're speaking of, strokes and TIAs, Parkinson's disease, one of those things that, again, I think a lot of our friends and family probably know somebody or have somebody close to us that's been afflicted by this in the past. Typically, is centered around a stooping posture, we call festinating gait, which is an inability to move your legs at a pace that is normal. So basically, it'll take the initiation of gait and slow it down, make it tougher to pick up the feet. Typically speaking, once they get their feet moving, they're okay. But if they have to stop again, it's a short shuffling gait pattern in order to get them back. Alzheimer's disease and dementia is also something that can absolutely be a huge proponent for why people fall as well. If you forget that you have a problem, most of us, relatively speaking, know, hey, my knee's hurting me, I'm feeling weak or unstable, I'm feeling lightheaded right now. Alzheimer's and dementia distorts all of that. So how do people know that they're safe to get up and move or they're not at that point in time? Neurogenic weakness. So we touched on this a second ago, lumbar radiculopathy, compression of the nerve root, whether that be from lumbar stenosis, a narrowing of the lumbar canal around which the nerve shoots out, or a disc protrusion pushing back into the nerve root, creating compression, basically shutting down the nerve fibers. They're sending signals for our muscles to contract. Simple things that we run into here are things like foot drop, which would be where you physically can't pick the foot up off the ground in order to propel it forward. The knees give out, or lack of glute control. How do we improve our posture? So we need to move weight over our base of support. So you take the first position there, forward head, flat back, rounded shoulders. I always say our back muscles are oftentimes meant to be like a marionette string, pulling ourselves straight upright, almost like we're coming up towards the ceiling. In the same breath, they actually work far too hard in most patients by comparison what they should have to do. So they oftentimes become fatigued, tight, stiff, and immobile. The number one reason I run into, and for those of you that have worked with me in the past, you've probably heard this spiel at some point in time, weakness in the glutes is probably one of the number one reasons why problems happen in the body. And if you gave me one muscle and said, Kyle, strengthen this in me and get the best effect across all your body, it is strengthen your glutes, and it's not even a close second. Because the glutes have the ability to pull our trunk upright from a forward bent position. They hold our back and our spine up. They prevent us from tipping forward. They extend our hip backwards to drive our leg forward and drive our body forward in a propulsive manner. Propelling gait versus advancing gait is two very different things. That's something that can also lead to falls too. We'll touch on that here shortly. When we look at glutes, they also, by naturally pulling our back upright, they pull our posture upright. They get our shoulders back and allow us to be more upright. If I'm tipped forward here, it naturally puts my head forward, which allows me to drop this way. Puts more strain on my neck muscles, force me to curl back up. So a lot of patients I run into that have kind of chronic neck and back pain or postural control, one of the first areas I go to is, can you contract your glutes appropriately? Can you isolate them down and contract one at a time? And it's a very, very high percentage of patients that walk in my doors with a problem with that. And that's absolutely something we need to address on a consistent basis. This is an easy way to reduce fall risk. And it's something where everybody can work on this at home without much need for equipment, not needing to go to the gym, and even, I'll be honest with you, not needing to come to see me half the time. If you centering yourself on controlling your posture, it's going to have a huge impact on how you move overall. So some simple exercises to help improve your posture: shoulder retraction, extension, flexion, abduction, and shrugs. Now, in each example, one of the common themes is bringing your body into a more upright position, whether it be pulling your shoulder blades backwards and squeezing, extending our arms down to the side, which naturally draws our chest wall open and brings it back upright. Same thing with shoulder flexion and abduction, reaching to the side and up in front of us, and shoulder shrugs, the same thing. Everything drawing backwards and upwards, okay? Tucking your hips in reduces kyphosis. It improves your lordosis. So when we look at typically that flat back that we were talking about before, that tends to lead to us more hunching forward. Tipping our hips backwards reduces that. Allows you to stabilize your trunk against other we call perturbations, which are outside exterior forces that try and throw us off balance. We're walking through the grocery store and somebody bumps into us. How do we then hold ourselves upright against that outside force? Your dog runs next to you and bumps into your leg as they're trying to get to their treat quicker than you can give it to them. How do we resist ourselves against that force? We need to work on balance. That is the number one thing. Fear of falling leads to most people not wanting to work on their balance. However, we need to put our bodies into a position to feel unbalanced in order then to retrain them into how to balance back. Your body knows how, your body has to know what it feels like to be unbalanced or to learn how to correct it. So I always liken it back to my kids. I've got two boys, almost 8 and almost 4. And when they were babies, one of the number one things we would run into is when they try to start to walk, what do? They crawl up, they try and pull themselves to standing, they take a step or two and they fall on their butts, right? And then they get up and do it again until they figured out how to rebalance and strengthen their muscles enough to allow them to balance, to walk consistently to the point they didn't have to crawl around anymore. Now they can run. Now they're off like lightning bolts. In the same breath, when we have balance-based issues, we need to work backwards in that same way, obviously without the falling part. So how do we do that? Well, in my clinic, what we do is we take your bodies in a safe environment where you are both stabilized and supported with your PT in order to allow you to work outside of your balance points and allow your body to know, hey, I'm moving to the side or I'm moving forward or my body wants to move backwards. And now retraining your body and how to respond to that in a safe environment. So that way, when you run into it in the outside exterior world, your body's ready to respond at a moment's notice. Your body needs to be on point and in response in order to make sure that you can jump straight into these issues. So that way we don't allow ourselves to get to the point where we're trying to search for how we should approach something. It needs to be automatic corrections at the drop of a hat. Ankle, knee, and hip strategies is something that honestly goes underlooked and underappreciated in a lot of cases. What this refers to is our ankles are typically our first response to our lower body loading. Our ankle and our foot hits the ground, and then it gives an immediate response back up through our nervous system to our brain to say, hey, this is the input I'm getting from the ground. What should I do? Our brain then has to send that signal back down to our ankle saying, contract this way and stabilize like this. Now, our ankle can do as much as it can do, but let's be real. It's smaller muscles, longer, leaner muscles, minus the gastroc and the soleus, or 2 big calf muscles. Outside of that, though, most of them are not nearly as big as our quads or our hamstrings, or even our glutes, right? So now the bulk of that force that can't be stopped with our ankle and our foot to stabilize now goes up to our knee. Our knee has that same response. Says, brain here's a signal. Brain shoots back a message saying, here's what you do. On to the hip, same thing. Until we have a strategy on how to take that instantaneous balance and instantaneous force input and now generate a better strategy on how to stabilize. Those things need to happen instantaneously. But what happens when you have a total knee replacement or an ankle fracture or a fall that fractures our hip? And now all of a sudden we have to then relearn these strategies. We learn from the bottom up, and we learn by putting ourselves in positions they're going to force us to balance. But without that force, our body does not relearn these things. One of the key exercises that we work on is single leg balance. I encourage people all the time to do this when we are doing something else. Brushing your teeth, filling something at the sink, looking in the refrigerator, trying to figure out what we want for dinner, or talking on the phone to people. I'm a huge fan of trying to exercise when you have other things you're working on at the same time. It's hard enough for many of us who are busy in order to try and create time in our day to exercise and take care of ourselves. Now, I can make the argument in a lot of cases, myself in particular too. It's a cop-out. We can find time in our day. We can find time to sit down and watch TV. We can find time to exercise. With that being said, let's try and find time that we're already using for something else and find time to put that into our balance, right? So can you stand on one foot while you're hovering over top of the sink with one hand and then brushing your teeth with the other? Realistic. While I'm sitting there filling my teapot in the morning time, my coffee pot, can I hop up on one leg and try and balance myself off? Those are easy spots to try and work on these sorts of things. Sit to stands. How do we go from a sitting to a standing position? So oftentimes what I tell people to do is to try and scoot towards the front of a seat, tuck your feet underneath you, and this is actually not a great representation of that. He's got his feet and knees more in a 90-90 position, but then to slightly lean forward in order to bring your weight over top of your feet. So again, that center of gravity, that cone of stability, and then launch yourself up from there. Same thing with a step up or a step down, working off that bottom step of the house, trying to drive yourself up towards the next step, come up, and then lower yourself back down. Slow and controlled movements work both ends of the spectrum. Squats is probably one of the number one biggest exercises that you can do for yourself. The keys to a squat are to maintain your knees behind your toes. Letting your knees go in front of your toes puts a large amount of strain on the knee joint itself. It also puts more strain on your quads and your hamstrings versus on your glutes and on your core. You want to keep your head up and your chest up and looking forward. You can absolutely put your arms out for balance. You can also have your arms crossed in front of you, hands on your hips, whatever position feels most comfortable. Hinging at the hips and sitting backwards and pushing your buttocks backwards is actually a great way to maintain proper position when you squat. What you should not do is you should not be leaning down and forward when you squat. You should be keeping your shoulders and chest upright, and then again, hinging slightly forward at almost like a 60-degree angle. What you see represented here too is a lot of different ways you can perform a squat. For those of us that need more stability, you can use a chair or the counter for stability. You can also try a freestanding squat with your arms crossed or your arms out to the side. Arms overhead is another way to change the dynamic of our posture and control by having the arms up in front of us. Holding a weight, we call it goblet squat, in front of us. You can use a kettlebell or a dumbbell for that, or even something simple around the house like a bottle of soda. Or holding weights at your side is another way. Many of you that have been down here with us have seen the TRX and probably worked on that before, the black and yellow straps. That's a good way to allow your body to help support itself while still retraining proper squat movement. Bridges is probably one of the most underrated exercises that you could put into effect today at your house to help you out a ton with a lot of different problems. The one issue we run into with bridges is that people typically do not create the right contraction of their glutes before they lift up. So they end up doing a bridge more so with their back and their hamstrings rather than their glutes. Think of your glutes like the big hinge in your back. If you want to extend your back and make the straight line between your knees through your hips to your shoulders, the glutes have to be the ones to push you straight upwards. What we refer to as safety lunges. And let me explain this for a second, because the picture here, I would say she goes down slightly too far. We think oftentimes too much of a lunge as I need to drop my weight downwards and touch my knee to the floor. That is oftentimes the way many of us have been taught a lunge in the past. With that being said, we want to try and shift the weight forward. So we'll take a step forward and then slowly shift the weight to the front leg, unloading the back leg. Most of the time with a lunge, I would typically tell people that we should have more of a 70-30 or an 80-20 split of our weight and our force from front leg to back, meaning that we're trying to create that dynamic shift. But if we really look at this position, it's very irrespective of walking and propulsion and absorbing our force when we first take a step. Unstable surfaces are another great way to create an unbalanced point underneath our feet. Things like a pillow or a Bosu ball or an Airex pad allow a changing surface underneath our feet in order to make sure we can stabilize ourselves while we do another activity. This could be a squat, it could be a trunk rotation, it could be other exercises like a bicep curl or shoulder flexion forward. But just keeping that unstable surface underneath us changes the dynamic of how we need to move. challenging walking stability through either sidestepping, backwards walking, or retro walking, using high knees like a marching perspective, or what's shown here is what we refer to as either carioca or grapevine, where you begin with your legs crossed, bring them apart, and then cross in the other direction. You can do this walking laterally inside, or you can just do this moving one step to the side and one step back to the other side. This one narrows your base of support tremendously, and also creates this ability to pull yourself out of these legs cross situations, where if you find yourself in that position, which we oftentimes will, again, it reteaches you the strategy of how to unlock your legs and shift your weight when you are in a very, very unstable position overall. Balance matters at the end of the day. It is the root of everything we do and the foundation of everything we do. And as I always say, we need to build our body on a solid foundation, otherwise it's going to crumble. So with that being said, this should be one of the main points at which we create our exercise, our propulsion, and our gait pattern, center around balance and center around this foundation overall. But if we don't work at our foundation, eventually we're going to find cracks. And that's it. Like to open up to anybody who might have questions, thoughts. I cannot answer specific questions regarding your own individual conditions based off of HIPAA regulations. However, I'd be happy to answer broader spectrum questions if anybody has any.
Kyle, could you unshare, please?
Yes.
Yeah. First, Kyle, I would like to say that was fantastic. That was
Thank you, Pat. Appreciate it.
really good. I learned a whole lot, and you have challenged me to incorporate some of these exercises in my daily life. I just thought walking on the treadmill was enough, but no, that's not enough. It doesn't really take care of the issue of balance.
Yeah.
Can you define glutes for us?
So glutes are the series of 3 separate muscles within our buttocks. Everybody thinks of our glutes as our butt muscle, which it is. Our glute max is the biggest one that controls hip extension, pushing our leg backwards. Glute medius and minimus are the 2 outer glutes along the outer part or lateral portion of our hip. Those are the ones that actually go very underrated in a lot of cases because they hold our pelvis level. When we go to take a step with this leg, our glutes on this side have to hold us straight. If they drop our hip this way, our whole body falls. That's when we tend to feel like, hey, I'm limping back and forth. Or I can't take a big step forward because I feel like I'm dropping in my hip, so I shorten my step. One thing I didn't touch on here that I actually want to just touch on very briefly is gait and walking. I feel like we kind of talked about assistive devices and tripping and all this stuff. Walking is extremely important in the grander scope of things, but it comes in 2 forms. Number one, we can either advance our leg, picking up our foot and moving it forward, or we can propel our legs. At some point in time, I think everybody's seen the old school Looney Tunes cartoons, Speedy Gonzales and Roadrunner. When they go to take off, what happens to the world behind them? It tends to spool up like a carpet unraveling, right? That's because they're trying to push the world behind them in order to take off and propel. That should be how we walk. However, most of us lack the dynamic glute propulsion in order to do that. So instead, we pick up our leg and move it forward in an advancement gait pattern. So rather than trying to propel ourselves, we try and pick up our foot, which puts more torque on our hip flexors, which puts more pressure on our back, and which forces us to balance more. Advancement gait is literally a single leg balance challenge, is what it boils down to. We're trying to pick up our foot in front of us and hold our balance. Try that once we're done with this presentation. See how long you feel like you can hold yourself in that position versus trying to push the ground behind you and launch yourself forward. It's a very different way to walk and a very different gait. But if you don't have good glute control to start with, that becomes a major task and a major issue. And honestly, I see a lot of people prophylactically to work on glutes and to make sure we have good processes. 2 other points. Number one, I preach this from the mountaintop, and many of you have heard this from me before. You do not need to go to see your doctor first in order to come see your physical therapist. Back in 2006, Connecticut was the 41st state to enact what we call the Direct Access Act, meaning that you as a patient can seek out physical therapy services without need to see your doctor first. The reason why this is important, it's not to bypass your physician. I'm sure all of you have great teams of professionals on your side. What it's meant to do is allow you to attack problems quickly and effectively. So if you have a pain, if you have something that's not getting better within the first 24 hours as you're trying to treat something, whether it be a tweak in your neck or your back or a strain in your shoulder, you can get in to see us on a very quick side where most of your physicians would typically refer you to anyways. It allows you to attack a problem much faster with better access. Most of my patients that subscribe to this tend to have a substantially quicker rehab time because we attack things quickly and get them on the acute side versus waiting for them on the backside, where now we're in a chronic stage of inflammation and forced in order to wait on that process overall. The other thing is looking at how we view our orthopedic health overall and our balance overall. Why wait for problems to come up versus trying to get screened ahead of time? The bulk of my patients will come back to see me, I would say, every 3 to 6 months to do a full head to toe screen to get ahead of problems before they become bigger issues. I hate seeing people walk in my door in chronic pain they've been dealing with for 2 months because our old thought process is it'll get better, just give it time, rest it. Why not be proactive? If something is limiting us, is preventing us from living our lives the way we want, why not push ourselves in order to be able to get over the top of certain things or to at least be able to manage them better? Not everything is fully correctable, but can we manage something to a better degree? Appreciate the time today, guys. I'll open the floor for questions at this point.
Okay. Remember, if you want to ask a question, to unmute yourself. Put up your hand if you want to get a question answered. Okay, John.
Actually, I just want to put in a plug for Jazzercise, which I've been going to for decades, and it works on all of these things.
Absolutely. There's lots of different ways to exercise. I'm always a fan of movement of any sort. So Jazzercise is a great one. Zumba, yoga, anything you can do in order to try and keep your body moving is a great way to go. And I always say there's no perfect fit for everybody. You have to see what works best for you and for your own body. So I'm a huge fan of working with patients that have a sense of what works best for them and trying to fill in the gaps behind that. But to me, there's no reason to not try something that you feel your body can attain and try to work within that.
Okay. We're being very quiet today. We've got 2 minutes of this wonderful man's attention.
I have a question about different kinds of canes that I see people use.
Absolutely.
Sometimes there's a handle and then it's straight, and sometimes there's a handle and then
Bo.
a little bulge on it, and then
Yes.
it's like, why are there different ones?
So mainly it's about hand position, how people feel stable. The curvature cane was easier to produce back in the day. So that's kind of the older design, because easy just to kind of take metal and or wood and bend it around a pole in order to create the shape.
Right.
Nowadays, what you're seeing is more contours to the hand that gives us a flatter point off of which to maneuver. So if you look at a lot of canes nowadays, you'll see where they come up, curve this way, hook around, and then flatten out back here.
Yeah.
Because it gives you a point at which you can push straight down and create better leverage. With a hooked cane, or a shepherd's cane as we call them, it doesn't give you that because you're kind of at a point where your hand has to fit up into that loop. It's an awkward position to really create leverage off of. So most patients today will utilize something that's a little bit flatter at the back, but there's also different kinds, whether it be a single point cane or a small or large base we call quad cane, which is the ones you see with the 4 points. They'll give you more support. They're heavier, they're a little bit bulkier, but they'll give you more stability. So for some people, they'll take, I just need a little bit of stability, but I don't want something so heavy and bulky that I feel like I'm dragging it along. Other people that are trying to avoid utilizing a walker or rollator will then try and utilize a large base quad cane to give them the stability they lack to allow them to stabilize but not feel as off balance.
Thank you.
No problem, Pam.
So walking backwards is a good exercise.
It is. The number one thing anytime you're gonna challenge your balance at home is to make sure you're doing so in a safe environment, though. I highly recommend utilizing the kitchen counter because that typically, in most homes at least, and again, not speaking for everybody, but it gives you at least some form of a run along the countertop that you can utilize for several steps in a solid surface to push off of. So that way, in the event that you stumble, you feel unbalanced, you have something right there. The other tip I always give is that if you are going to do balance-based activities and or challenge your balance in walking, do so in an area where you have a spot to sit. If you are trying to do squats for the first time and you're unsure of your stability and how deep you can go, put yourself in front of the countertop. Put a chair directly behind you. So that way, when you go to squat down, your buttocks is almost going to hit the chair first. In the event that you either slip, you need to stop. Something is very painful. You have a spot right there where you can then take your rest and you're in a safe position.
Yeah, it'd be embarrassing to hurt yourself trying to exercise.
You'd be surprised at how often it happens, to be honest with you, Pat. It's a very, very common thing, and it's something that a lot of people unfortunately struggle with. Another point I'll make really briefly is that a lot of people feel awkward and or painful because they're trying to start an exercise and either they feel like they're not doing it properly and or they feel like they're not getting the desired result. And oftentimes this is where we as PT step in order to try and help people generate the proper force in the proper way to allow them to move and create that dynamic nature of the exercise they're searching for that maybe they can't find. So I urge this overall for everybody. If you take nothing else from this, take this. If something doesn't feel right, examine further why it doesn't. It doesn't mean you can't do something. I hear this far too often from patients. I can't squat because I've got degeneration in my knees. Well, I'm going to give a generalization right here overall, but myself included right now, I guarantee you if I took x-rays of everybody's knees, I'd probably see some level of arthritis in everybody in this room. And that's okay. It doesn't mean it should stop you from walking or squatting or lunging or doing things. It's a matter of finding what that right mixture is. How deep should you go? How much load should you have on your legs? What other muscles are allowing your body not to function the right way? I could spend a whole nother hour talking about the knee alone and the mechanics behind it and how awful they can be. But I'll go back to what I said earlier when it came to using your glutes in order to maximize your body. Your glutes stabilize your femur, the long bone of your leg, and the upper part of your knee. If your lateral glutes, your glute medius and glute minimus out on the outside of the hip, don't function or hold your pelvis upright, your whole femur dips inwards at your knee. So if your knee does this in gaps, you're compressing on one side and opening up the other. You can't track properly at your knee in order to squat, in order to stand, get up and down from a chair, go up and down stairs. We need to find the reason why things aren't moving well and then work backwards off of that, which circles right back to why it's important to get ahead of problems before they become issues for you. Nothing is ever foolproof, and we're always going to break down at some point in time. It's the nature of our body. You know, many of you who know me have heard this analogy. Our bodies are the 56 Cadillac sitting in the garage. Sometimes we need to pump the gas a couple of times or get ourselves to move properly. And also, the 56 Caddy takes a little more maintenance than does the brand new ones coming right off the showroom lot.
Yeah.
It's okay to require some maintenance. It's okay to put that time and energy back into your body. Our goal here as a unit is to live long and to live independently, right? Put that time back into yourself. Put that time back into your own bodies in order to make sure that you have the right stability for yourselves on a long-term end. But if you need help, if you need to be able to, seek out assistance with that, don't hesitate. There are plenty of good PTs. There's plenty of good, doctors that can help you out with that and give you great advice. I'm here. I've been here in my entire career in the community to help people, and I've been fortunate enough to help a lot of people over the course of my time. I take that very seriously. And if anybody needs my assistance, my contact information is up there. I'm sure the ladies will be nice enough to share that as well. But I'm happy to help where I can, lend assistance where I can, and to help you great people stay on your feet for as long as possible and keep you actively engaged in the way that you want to be.
So I've used Kyle, full disclosure, at MDPT on and off the last year or so. Go back, come back, go back. It's time to come back, Kyle. Need a further tune-up. I get a lot of exercise, Pat and I both get a lot of exercise working around our property, which is good because it's unstable and rocky and lumpy. And I kind of keep reminding myself from Kyle, okay, how to walk, how to approach, how to lean, how to bend over, all good stuff.
Appreciate it, Rick.
Yeah.
Unfortunately, I am coming up against my time frame right now. I do have a patient that needs to start shortly. If for any reason anybody has direct questions, concerns, feel free to email me, call me directly. I'm happy to consult and see how I can help in any way, shape, or form. And if anybody has any other questions, I'm always accessible.
Kyle, thank you, thank you, thank you. This was
I welcome
excellent.
that.
Really appreciate it.
Hey,
We will do it again.
Absolutely. I look forward to it. By all means, if there's other topics that, the community wants me to speak on, I'm happy to put something together to kind of give a different dynamic overall, but this is always fun for me and I always enjoy it.
You do
hope
it
everybody
well.
hope everybody has a great day and a great weekend. I look forward to seeing all of you at different points in times. Hopefully not everybody right here, but that means we've got
Not in
problems
pain.
going on, but
Thank
I
you
look
so
forward
much.
to seeing all you in the community.
Okay,
Thank you.
Thank
Kyle.
you.
Take care. Have a great day.
see everybody.
Bye, everybody. Office closed on Monday, just letting you know.